Welcome to Candid Conversations with Dr. Kelly, where we dive deep into the conversations that matter most to your mind, body, and soul. I'm your host, Dr. Kelly Utenham, a passionate advocate for brain health and wellness. And here on this podcast, we explore candid conversations about life, health, and the stories that shape us. Whether it's about mental health, sports, or simply navigating everyday challenges, we keep it real, raw, and relevant. Without further ado, let's get into today's episode.
Welcome to another episode of Candid Conversations with Dr. Kelly. I am elated to have the guest that we are going to have on today. We are welcoming Leah Braidi to the show. Thank you so much, Leah, for being here.
Thank you for having me. I'm super excited.
I'm excited too. So, Leah is a soccer player. She played in college and she has been able to bridge her experience in sports, and she is a speech language pathologist, listeners. So, I always like to let my guests tell us a little bit about themselves. I was fortunate enough to meet Leah. She came to the 6 hour course that I did in New Jersey, which is where she lives. So I will toss it to you, Leah. Can you tell us a little bit about yourself and how you got into speech and soccer?
Yeah, certainly. And I'll do my best to keep it brief. I'm notorious for saying long story short, but the story's already long at that point. My name is Leah Braidi. I'm happy to be here. Thank you again, Dr. Kelly, for having me. I'll start with what my first love was soccer. I started at 5 years old and I never stopped playing. I played some other sports mixed in, but soccer was always at the forefront of my passion. And I played consistently through my college years, ending at the collegiate level. I was a 4-year starter and 2-year captain of my team in college. And then kind of after college was done, soccer kind of left my scope. I was focused on my studies. I majored in speech language pathology as an undergrad, and then proceeded on, of course, to my graduate studies at the same institution that I was at, which was Stockton University. Shout out, that's in New Jersey. And I worked my first 6 years as a speech language pathologist in the skilled nursing setting. Was there through COVID. I'm going to try to gather my thoughts here. And essentially, after COVID kind of hit, I started to pursue my fitness passion, which was driven by my own kind of banged up body after soccer. I was experiencing chronic low back pain through my graduate studies and through my early career as a speech therapist. Didn't really know how to get myself out of pain and just kind of started to figure it out on my own, and then became passionate about helping other people mitigate pain with movement. Was presented an opportunity shortly after kind of transitioning out of that skilled nursing role and into kind of more focusing on my business. I was given an opportunity by actually a college teammate that I hadn't spoken to in years, who had started a business called the Keeper Institute her wife had, and she was working with her there. And they were looking for an in-house strength and conditioning coach. And that was 3 years ago. I still practice speech therapy to this day, but I am on the other end of the lifespan. I work with 3 to 5 year olds in the early school age setting for the Philadelphia public school system. So I still do that part-time. I would say most of my time is devoted to my business as a strength and conditioning coach or personal trainer. I label myself as both of those things. And I've been reintroduced to my passion of soccer, my first love, through this opportunity with the Keeper Institute. And I work with athletes starting at ages 12. I've worked also with professional level athletes, mostly obviously in the soccer field. And that's kind of where I am now.
That is amazing.
I left a lot of details out, but that's kind of the course of time that has brought me here.
Well, I want to get into all of that, but I want to go back a bit because you didn't mention, you did talk about, how you were into your studies, but you are brilliant. You really did well in school, which is quite an accomplishment, especially for you being a collegiate athlete and being able to keep your grades up. You were recognized for your grades, weren't you?
I was, yeah. So I think to this day I'm the only academic All-American at Stockton University, at least for women's soccer.
That's amazing.
Yeah, so that was a recognition of both my playing and my GPA at the time, which um don't think I
Was
quite
really
held a
high.
four. Yeah, I don't think I quite held a 4.0 in undergrad, but I did in my graduate studies. So I
Wow.
was always
Well,
pretty driven as a student.
I hope you're proud of that. I'm proud of that.
Yeah,
That's
thank
a
you. I
huge
am.
thing because I know that collegiate athletes, like your schedule is so rigorous. Like you almost don't get to have a like collegiate fun party. Like not that that's all that college is, but like
No.
collegiate athletes really have an intense and grueling schedule. So for you to be able to achieve what you did physically with the sport and academically is just, I tip my hat to you. That's such a big deal.
Well, thank you. I appreciate it. It's like honestly, I think I've always have functioned better in that environment of being busy and having like being forced to prioritize time and to organize it. I'm a procrastinator. I always have been, but I think that the crunch time really always allowed me to just be the most productive. And I just thrived in it. Really, I'd had to try. I'm not saying there wasn't effort behind it, but yeah, I definitely thrive in the chaos. I don't do well in the quiet. That's for sure.
Absolutely. And as a fellow procrastinator, it's been a long-term goal to work on that. But I heard that it's a form of anxiety. I'm fine with that. What I mean, I've heard it both ways. I can see where there could be anxiety around it, but I mean, you get it done. That's what matters.
Yeah. Yeah. No, you do. Like I look back on it all the time and I'm like, well, I still got it done. And like
And well, you get it
right.
done well.
And even when I've given myself time, it's like I'm like, well, maybe I won't rush so much and I'll like take like 2 weeks to work on it. There's still always like that
That
day
last
before time
minute,
period. Yeah, for sure.
yes.
That's
But then
me.
it's always awesome.
Yes.
It doesn't help
The product is
when you're
good.
trying to get better at it, when it's like, but it still turned out so awesome.
Yeah. Agreed.
We'll keep that on the long-term list of things to work on. But I want to talk about if you could think back to your time at Stockton and what do you remember most about the intensity of being a collegiate athlete, like the physical, mental, emotional component that goes into it? So much is weighing on you all.
Yeah, I think in hindsight, when you're in it, you're just doing it. And you kind of live for that, hey, Tuesday or Wednesday game day, Saturday game day, you know what your week's going to look like. Practices are going to look like. I've always thrived in a team environment. Individual sports was never my gamut. I did throw javelin and I did track, but you're still as a part of a team there. So I was close to my teammates. They always kind of motivated me and I was always happy to see them every day. I was a team player. Um, and yeah, I'm going off track a little bit, but I think that I kind of lost my train of thought, Dr. Kelly. Sorry.
No worries. We're
Yeah,
talking about the intensity of being a collegiate athlete,
right.
that physical, mental, emotional component.
Got it. In the moment, you're just doing it, right? You know it, you're enjoying it. It's fun. It's what you signed up for. And then I think in hindsight, as I kind of reflect on it now, there's some pretty transformative years, like as a young adult, when you think about it, you're still 18, 19, 20, 21 years old. You're finding yourself and you're developing relationships with people and experiencing heartbreak but also having to like be in your studies and perform on the field. And that was something that never suffered for me. As far as like when I think about stepping on the field in soccer, like I could just turn it on and just like the flow state that athletes talk about. It didn't like once that whistle blew, like it was just game on for me. I didn't think about anything else. I didn't have to think about anything else. Life was just on pause. So I think in the moment you're doing it because it's what you do and what you have done. Like I said, I started playing sports when I was 5 and I never stopped. So I think that, I have a different perspective now, but in the moment it was a blast. I had a great time.
Good.
Yeah.
Well, like any true soccer fan, but I told you prior to us hitting record that I did play soccer when I was much younger, but I also got distracted when I was tired about finding those lucky four-leaf clovers. But, and listeners, Leah did say that is a common situation when people don't follow through and complete soccer. She hears about how you're in the field looking at the four-leaf clovers or something else that might interest you while you're tired. But I am a Bend It Like Beckham fan, and I
Oh,
want
great
to
movie.
know, yes, I want to know your thoughts on the movie. This is totally not part of our question base, but I love this movie. I love the Beckhams, and so I would like to know your take on this amazing movie.
Yeah, so it's funny. People always say, like, have you seen this movie? Like, I'm notorious for not knowing any of the classics. I grew up in a house that we weren't really like pop culture movie people. Like, my parents were like, you have to watch this movie. It's like, it's part of your childhood type thing. There's a couple movies like that, but Bend It Like Beckham, like when you have a passion and then as a kid, like it's depicted in a movie that you can watch, especially with females in soccer. Such a cool movie, such a cool concept. I actually heard that they're coming out with a yeah, I don't know if you heard about that. And I can't confirm it for sure, but I've definitely seen that in two separate, yeah.
That
So you have
there's
to
gonna
look in
be
you have to
another
look
Bend
into
It Like
that.
Beckham.
Yeah, like a sequel or whatever. Yeah.
Oh my gosh, I'm
You have to
trying not
look
to
into it.
scream, but I love that movie so much. I would love that.
Yeah,
Okay,
but great movie.
yes, great movie. Okay, what's your favorite part?
Oh gosh, I have to think about this one.
Take your time.
Yeah, I'm thinking about the mom. I can't quote it exactly. She was hilarious to me. And uh there's a part where she definitely makes a reference to like the daughter like wearing something and like was trying to get her to be more feminine and like show off for the boys, and like I could relate to that. I didn't know at the time. But at the time I'm like, yeah, I could totally relate to that. Like, I don't want to wear a dress, I don't want to get all frilled up. I just want to play soccer. So definitely like any interaction that the mom had with the daughter in that movie, I could relate to maybe just a little bit.
Okay, all right. I like the best friend angle of it.
Yeah.
Yeah,
Yeah.
the two main characters had just such a great friendship, and then it takes you through that like, first love and forbidden love
Yeah.
and fighting over, the love interest and all of that, and but how they are able to still come together and be friends and go and pursue their soccer dreams together. So I love
Yeah.
that movie.
Yeah, definitely a nice coming of age type story within it, obviously. But yeah, great movie. And yeah, the Beckhams, I've
Absolutely.
watched some of the recent documentaries on both of them. Wonderful people by the looks of it. I don't know them personally, obviously, but
I
by the
was
looks
gonna
of
say the
it,
same thing.
and
Yes,
great stories.
I love the Beckhams, and the documentary that talks about both of them, their background, how they met. I didn't realize like the backlash or the drama that was surrounding Beckham with the different teams that he was
Yeah.
switching to and him coming to America. Of course, in America, we're like, yes, we got Beckham, but it was such a weight on him to have to actually make that decision, their family. So if you all haven't listened to that or watched that documentary, please make sure that you give it
Yeah, very
give it
good.
a watch. Worth it, totally worth it. Okay, getting back on track here.
Yes.
I would like to know about heading the ball because I know that
Hmm.
in soccer that is a huge routine part of the game. So when did you first start practicing headers? And first, could you tell us what headers are?
Sure. So, a head ball is just a not, you can't touch the ball with your hands in soccer, but that's about the only body part you can't touch the ball with. And heading the ball is usually, a method of gaining possession when the ball's in the air, right? You're not going to head a ball that's on the floor, essentially, or on the grass. So a lot of times the incidence of heading happens more often in like set pieces or corner kicks when a ball's lofted and then we're trying to deflect that ball into the goal mouth, or we're trying to deflect it as a pass to someone, or sometimes even from a defensive point of view, which I was more of a defensive player. I was a defensive midfielder, which they'd call the six. They talk in numbers these days in positions, so it's the six these days. It's a method of getting the ball out of your defensive end. So if someone were to like have a big kick from the opposing team and I see that ball coming, I'm going to try to head it back in the opposite direction to get it away from my goal. So just another method, just like kicking or trapping the ball with your thigh, or even like chesting the ball to an opponent or to a teammate. It's another way of manipulating the ball, I guess you could say, to put it simply.
Yes, but I'm thinking, of course, concussion. If
Yeah.
you're saying that it's launched from, a significant distance, I'm guessing they're not standing right next to you if you're saying launch.
Yeah.
But that means that the force of that ball is picking up speed as it's being launched, and then it meets someone's head, and you have to put force and effort to project it back in the opposite direction.
Correct. Yeah.
Whew.
hmm
Okay, does it hurt?
Yeah. It's funny you asked that. I've rehearsed this, like some things that you maybe asked me on this podcast prior to this. But the way I've described it in the past is that, let me just preface this first too. Heading the ball was like my X factor, if you will. I was known for it. And that's kind of also why I was inspired to talk to you on this podcast. If there was an opportunity, even if it wasn't a strong opportunity to head the ball, I was going to head the ball. I was going to find a way to head the ball. And most of the time, you head the ball. But then there's some instances when that ball comes from a greater distance, or you don't time it particularly well when you're in the air. And I've always described it as that's when the ball heads you. And you can almost feel that you didn't put force back into that ball, but there's like almost like a whiplash type, no forward projection of your head effect when I use that statement. Sometimes the ball heads you.
Wow.
Yeah.
Does it hurt?
Oh, does it hurt? You did ask that. When the ball heads you, so when you're not timing it well, or if the force is just too great for you to overcome in the opposite direction, hurt wouldn't be the first word that came to mind. I have heard on your podcast, and I've always used this term too, kind of the bell being rung effect. You feel like the direct effect of like, whoa, like that didn't go how it was supposed to. But I think that there's definitely a technique to heading the ball. And I wouldn't say that like it hurt. Maybe like a sting if it was like a cold game, or like the weather was cold and you weren't quite prepared. Maybe a sting like from the surface level. But to say it hurt, didn't really hurt unless, again, the ball headed you, or just so you caught it at a wrong angle. Or of course, maybe collided with someone in the process.
I'm going to ask you about that too.
Yeah.
Okay, so you're talking about technique.
Mhm.
I only know from what I've seen. What is a good or proper technique for heading a ball?
Yeah, I think that I think you had mentioned this in your previous question, but I can first like recall learning to head the ball, or like how the technique for learning to head the ball when I converted from like recreational league. Like that's when you go like just to your town every Saturday and you play like in the same fields. Then you go to travel or club, they call it more so these days. And that's where like you're playing teams from different cities around the state. And that starts probably around like the age of 8 for some people, like you make that transition. So I think my earliest memories of learning to head the ball was probably somewhere around that age, 8 to 10. And I remember basically in like, again, it's like a controlled versus uncontrolled environment, right? When you're in practice, you're like, people are lofting you the ball softly, right? And you're working on like pushing your head through. I was always told to like kind of cock back basically, and then push your head through the ball so that you can kind of generate some oppositional force towards the ball. But I think that when you do it a lot, and I did do it a lot, I think you just like understand some body awareness, and you learn how to manipulate your center of mass in space, or your center of gravity in space, and timing and all of that, like jumping off the ground to head the ball. And I think that it just kind of translates to like a full body movement, versus in practice, you might be just kind of lofting it and putting your head through. But that's about as specific as the technique conversation ever got for me. I just kind of learned how to do it.
Okay.
Yeah.
I'm envisioning soccer players when they will head the ball, but they're bouncing it, like almost they're dribbling it off of their head. That's
Yeah.
got to be a serious skill to be able to do that.
Yeah, like that personally, like I can't really do that. I was more like aim and fire type thing, is like the ball's in the air, time it, head it back. But Yeah, that's definitely a specific skill to be able to kind of do the juggling off your head. I was never able to master that, unfortunately. Probably fortunately, but unfortunately.
Now, fortunately, back in the day, before all this came out, probably way cooler. But I'm thinking I might get one off and I may a second one, but only because that's probably just going to bounce off of my head, not from any kind of skill. Okay. Looking back, how much emphasis, if any, was placed on concussion prevention in your training or coaching?
I didn't recognize or remember recognizing the potential risk of hitting the ball until college. That's when the conversation always come up. Like my parents were so supportive with my sports. They came to every game, my grandparents, my family members when they could. And I was, like I said, I had started hitting the ball at a really young age. And I do remember like my mom saying, like, I'd get done the game and she'd rub my head and she'd be like, oh, I wish you wouldn't do that, or my grandmother would say that. And I'd be like, well, I thought it was cool. And I thought it was like, a special skill to have. And I didn't know that there was anything wrong with it at the time. And it wasn't until college that, you get to orientation essentially for like sports, essentially. You get to preseason and then you have the talk from athletic directors, you have the talk from athletic training staff. And they tell you about, all different things. And it probably was a little presentation on concussion, but nothing that was profound enough to stop me from hitting the ball, because I got to college and I was still hitting the ball. There was impact testing. I know that people had mentioned that on your podcast episodes before. You'd mentioned that at your presentation that I was at. And I remember taking the impact testing. I don't ever remember having to retake it because I never had a reported concussion in college. I'm not saying I didn't have one, but I didn't have a reported one. And yeah, that was it. It was kind of like you get your bell rung, or like someone kind of looks. And I think that unless you self-reported at the time, and just to give people a timing kind of a grasp on timing, I played from the years of 2010 to 2013 at the collegiate level. So it was even before like the movie like Concussion came out. That came out in 2015. So I knew the risk was there. I had teammates that suffered from symptoms of concussion, but I think I kind of just always looked at it as, well, it didn't happen to me. Like, that's not happening to me. And I don't know why, but it never stopped me or deterred me from hitting the ball.
Did you have a teammate or even someone on an opposing team who did have a significant head injury that was kind of heard around the team or around the soccer space when you were playing?
Yes. So several. Two come to mind. One was a teammate. She was older than me. And that was a situation where I kind of just looked at it as it was unlucky for her.
Is this the collegiate level as well?
Yes. It's kind of wrong place, wrong time. I remember in my course of playing with her, I think it was in a season, or maybe it was distributed across 2 seasons, but I remember the timing. She was a defender. She kind of turned her back to the ball a couple of times when someone was kicking it to clear it. And unfortunately got hit in the back of the head with the ball. So it wasn't even like she was heading the ball in those instances, but she had headed the ball in the past. Because again, as defenders, I think it's more prevalent if just because we're trying to get the ball out of the box from either corner kicks or just from the ball progressing from the opposing team. But what kind of sent her over the edge of with symptoms was getting those couple of hits in the back of the head. So almost probably like an opposite, like a reverse kind of whiplash. I guess you can still get whiplash from the front side, but the back
absolutely
side. Yes.
But she didn't even see it coming.
No. And I remember like the one that took her out. I don't think I remember her playing after that. It was her senior year, I believe, but I don't remember her being in a game after that. That last one. And then in college as well, it was either my freshman or sophomore year. A girl joined the team, if you will. Coach was like, this is so-and-so. I didn't get permission to share, or not in terms of, I didn't ask permission to share her name.
It's okay.
I'm sure she wouldn't mind, but I'm going to refrain for right now. This is so-and-so. She can't play, but she loves soccer and she's going to be our manager. She's going to help us out. And we later found that her story was very sad. In high school, she wanted to play at the collegiate level. And in high school, she basically had a season or career-ending concussion, was struggling with post-concussion symptoms, headaches, lots of pain in the head, which unfortunately in that period of time, that short period between like stopping playing and then getting to our team as a manager, if you will, an honorary member too, she had attempted to take her life. And as a result, because of the pain she was in, and I won't share the method, but it resulted in another blow to the head, which just exacerbated these symptoms. She struggled with seizures, headaches, missing class. As in college, we all kind of took her under our wing, but she was our hype man. She showed up in the locker room for games in a Ninja Turtle costume, and just hype us up. We played games for her. We wrote her initials on her hands when she was struggling, because she had good days and bad days. But I just remember, as I learned more about her, she actually had the diagnosis of post-concussion syndrome. She wore one of those like head buddy things, like the headbands. And it was more so because she'd have seizures and they were unexpected. And because of the seizures, she could drop and hit her head. So they thought maybe adding that would give her another level of protection. So yeah, it was around me.
Wow.
Yeah, it was around me and at the collegiate level, and I'm sure at the high school level and things and club level, but college is what I have most memories of as far as playing. And that would be when I would say like I understood the impact that this could have, but I still just, I think, viewed myself as, well, I must be just be doing it right.
Hey, listeners. If you're enjoying today's episode of Candid Conversations with Dr. Kelly, then take a second to like, share, and subscribe. Every listen helps us spread awareness, spark conversation, and educate communities about concussions, CTE, and overall brain health. Together, we're changing how the world thinks about the brain, one conversation at a time. So tap that subscribe button, like this episode, and share it with someone you care about. And let's keep the candid conversations going.
Which is the way the human brain works. Which
Right.
is why I started Brain Talk Foundation, because the human brain, our personal stories, a lot of times we hear things, we see things, we experience things, like with this young lady who was you all's manager. And you think like, that's really unfortunate for them. But then, and that next thought is like, but it can't happen to me. It won't happen to me. Or I'm different because of whatever reason. I'm heading the ball right, or whatever the thought process could be. And I think that is kind of self-preservation, which also leads perfectly into my next question, which is, as a collegiate athlete, as, playing at that serious heightened level, what goes through your mind when you could have been educated extensively on concussion, the risk of CTE? Athletes a lot of times may not want to hear that because it could mess up, their thought process, them getting into the zone. You may not head the ball as, confidently if you know that, one of these could lead to SIS, second impact syndrome, or it could result in something more serious for the rest of my life. And that can change the way that you play. Could you speak to that a bit?
Yeah. I knew you'd ask this question, and it's hard to answer. It really is, because as an athlete, there's an ego involved. Like, you're an athlete, and I told you, like, I stepped on, it's like flow state. I want to win. I want to get the ball. I want to be an impact. I want to positively help my team. And maybe not having direct education, but I had the signs around me, right? I had this, like, there's potential here, there's potential here. I think that's what's most profound to me now is, and even just in coming, I told you, like, I felt like fate coming and finding your speaking engagement just a few weeks ago or a month ago. I don't think until then that I understood, and hearing someone like Nia's story that you covered, that just because you don't have acute symptoms upon impact, or like close in time to when you're experiencing this impact, right, to your head, when I'm talking about impact to the head now, doesn't mean that those symptoms can't show themselves later on, right? In Nia's case, we saw that too. in her episode where she had these blows to the head as a child, and it wasn't until later on that she experienced symptoms. And understanding that, I became super emotional at your talk, because it's like, I don't think to that point it still wasn't clear to me, like whether I wasn't accepting of that information or whatever it wasn't clear to me that like this could have had lasting and can still have lasting impacts on me, consequences. But to ask me if at 19 years old, when I was playing the sport I loved and playing it in a way that I just felt so free to do so, if you told me these things, I don't know that I would have changed that. I can't answer that question. Maybe I would have headed the ball less, but I don't know that I would have stopped, and that's just an honest answer, because I've grown and learned and understand that, like, as kids we're like, or even as at that age, like teenage and early adulthood, like you're invincible, like can't happen to me. And I think that, I think it's a very hard question to answer. I think that if anything, maybe it would have changed how frequently I would have. Maybe I would have refrained in practices, right? But if I could score for my team on a head ball or like a set piece, like I was that person. Like, Leah, go up there. I was a defender, but they would send me up for offensive plays, hoping for the opportunity for me to connect my head with the ball, because I could pretty much beat anyone to the ball in that regard. I'm not trying to brag. I'm just saying that's the type of opportunity I had to, and responsibility as like a team, like as a member of the team, like, Leah, we got to score, like get up there. And if it meant like like I sent you some pictures that you maybe see later on, but even if it was a ball that was like at shin level and I had to dive to get to head, like I was going to do that. So it's hard to say, Dr. Kelly. It really is.
Understood.
Yeah.
I mean, what I'm hearing is you are a phenomenal athlete and a really great team member for the way that you're describing how you play. I am a former athlete. I played in high school. I was a cheerleader and I ran track.
Mm-hmm.
And did some field events. Javelin is really impressive, by the way. Didn't want to interrupt, but I'm just throwing that out there. But I know what that's like to want to win for your team, help your team, and doing whatever it takes at the sacrifice of your own body, pain, whatever that could be in that moment. So thank you for that honesty. Athletes answer in that way because it's like the ferociousness that you approach your sport and your craft is part of that ego. It's part of who you are, what you work so hard for, all the hours that you put in so that you can be so great. And then when you're on the field, it's like time to prove it. So I completely understand that. It's tough though when you learn the things that could have benefited or aided you at that earlier age. So I'm in that interesting spot of sharing this information with people who can benefit from it now. And so that people don't feel guilty or ashamed because, you pour so much into this. And I think me being a former athlete is an important piece to what I'm saying, because
Absolutely.
people hear doctor and they hear concussion or CTE. And the first thing they think of is like, she's trying to get me to quit or she doesn't want me to play. And I always have to put emphasis on that's not my intention. I want people to stop having to say, oh my gosh, I wish I would have known. So people can hear this information and they could take nothing from it, but at least they have the knowledge so that they can identify, okay, I'm having more headaches. Maybe this is something for me to keep an eye out on, versus when I speak to some athletes and they're like, I just take whatever Tylenol or Advil that's around and I just, grin and bear it and deal with it. To know that there are options for treatment, that there are other professionals that could provide them some relief if and when they decide to. I want athletes to have that knowledge. I want educators and parents and coaches to have that knowledge because, sports aren't going anywhere. The love of sports aren't going anywhere. Athletes aren't going anywhere. But if we can provide them with the knowledge and education for themselves so they can make the best decision for themselves, then I'll be happy.
Yeah. And I think, I think that a great way for me to kind of conclude it, at least that question or my thought on it, is that looking back, I don't think there was enough emphasis, or maybe even just understanding. Maybe there was an understanding yet of the potential of what like how important it was, like if you feel like you've experienced a concussion, to report it, or to at least tell someone so that they can maybe, you know, keep an eye out, or be your buddy to say like, hey, like you should tell so and so, or you should tell the trainer that like you're having headaches. And I think that, like you said, I agree with you. You don't want people to have to say, I wish I would have known. You don't expect people to stop playing sports, or to stop being like, to muffle or silence the athlete in them. But you want them to make informed decisions for themselves, right? Like that's all you want. Like you make a decision, it should be informed. But I think that at the time that I was playing, there was no information. Like the information itself was lacking. It was just like, we have to kind of cover this because it's a buzz thing going on right now. But there was still, like, I'll be honest, like those moments where the bell was rung and I'm like, oh, like, you know, that little head shake you talk about.
Yes.
I can't even probably guess how many times.
Spontaneous head shake.
Yes. But even like conversations of like making it hush hush, like on the bus, like if someone was like, does anyone have Advil? Like I remember, I have to share this because I just remember it. I was part of it, and I remember it, and it kind of makes me a little uneasy now to think about. But I can't remember if it was me or my teammate, but it was the two of us kind of in this conversation on the bus. It was a really tough game. I don't remember if we won or lost, but someone yelled out, whether it was me or the friend, which one shouldn't you take if you think you have a concussion? Like meaning Tylenol or like Motrin or Advil, meaning like the NSAID or the acetaminophen, you know what I mean? And I remember someone like, shh, like, because coach was on the bus. So here's a situation on the bus where like, we know that someone probably is concussed, but we know that if they admit that, they'll be out. And that person didn't want to be out. And then it's like everybody kind of protecting them because like, just a concussion, you know? And that was the mentality. Like as 19, 20, 21-year-olds, like we had that. It would maybe be different now, but that was something that happened. I remember it was like, we knew better enough to ask like, which one shouldn't you take? And we knew better enough to keep it quiet so that coach couldn't hear or someone could report it.
I hear stories like that often, even to the packs that people take. Like if you are injured on the field and you think that it's brain related, the teammate will say, well, grab your shoulder, grab your hip, make it look physical versus that concussive piece because of the consequences of that, of either being pulled out, put on concussion protocol. For an athlete, just you're messing with my playing time. There's a chance I won't be on the field. I could lose my spot. And those are high value concerns for athletes. So that is a very telling story. So thank you for sharing that.
Yeah, absolutely.
Perfect lead into my next question. We're really flowing here.
Yeah.
I want to talk about the difference between female athletes reporting concussion and male athletes reporting concussion, because studies show that there are much higher reported numbers of concussion in female athletes than in male athletes. So I want to know your take on that and why you think that is.
Oh,
no pressure.
No, I know. I don't know. I'm not well versed on the differences in terms of how forthcoming males versus females are with their feelings, but I know enough males and females in my life, and I've read enough psychology books and just human behavior and nature, right, to know that you know, males might just have like that athlete ego, right? We all have that athlete ego, but then you add like the male ego. No offense, love my males, right? You have the male ego,
testosterone,
like, right? Like I'm you know, that's weak, right? It's fueled by like still that I don't want to let my team down. I don't want to let my family down. There's so much more at stake these days with NIL and things like that, where these kids are making money. And we've talked, you know, you talked about it in your presentation, like the generational wealth that comes from these athletes, like, or even just approaching that time and anything that could interfere with that, right? So I don't know if it's the biological nature of men to not be as forthcoming. It's like the kind of the same thing concept of therapy, right? Like I'm sure if you looked up the statistics with therapy with females and males, that females, there's probably
That's a
more
good
females
point.
in therapy, right? Like willing to go there to admit like this is something that's going on with me, that could impact and change their identity as they see in themselves, how they live their day to day. But yeah, I don't know. I don't know if it's the deep down seated maternal instinct that females kind of have. Not that everyone needs to be a mom, but I'm just saying like that, you know, I need to take care of myself. Yeah, I can't tell you the exact reason, but it makes sense from what I know of human behavior and just kind of what I know of the men versus the women in my life, and how forthcoming they are with just being honest, like, hey, I'm struggling, you know? But I think from like an acute standpoint of like reported concussions, like reporting a concussion right after it happens, I think we can't ignore what you've mentioned before is like the structure, right? Like maybe females perceive from like a physical standpoint can actually feel that impact that occurs to them at the time of a possible concussion. And maybe males don't because they're stronger and maybe like they don't feel that as heavily as of an impact. I'm not really sure. It's a great question. It's great. Something that's worth looking further into.
Absolutely. And I really liked how you brought in the therapeutic piece, because that is a worthy comparison when it comes to males and females and getting yourself checked out and checking in with yourself and calling a thing a thing. I think it also could be cultural in that, like you mentioned before, how males are, you know, that's weak, you know, put some dirt on it, deal with it, shove it down.
Yeah.
And with the females, it's more acceptable, I should say, you know, in society, if we were to say, man, something's going on and I want to get it looked at or checked out. That's not seen as weak. There's just a difference there. But thank you so much for speaking on that.
Yeah, absolutely. It's a great question.
Thank you.
Mm-hmm.
I want to get into the speechy side of things. I love that you were in the sniffs, which means that you're on the medical side with me.
Yes.
So I want to know, when we talked after my course, you were talking about how this has really been able to bridge the two worlds between your profession and your passion. So could you speak to that?
Yeah, sure. So I mentioned earlier briefly, you know, that I made a complete career change. I still love the field of speech language pathology, which is why I still do it. And, you know, I never wanted to leave it completely. And I think that I didn't necessarily recognize it at the time, but it was almost like I could never find a way to take this very specific skill set that I've developed, right, as an SLP, and direct it into like working with athletes or like as a strength and conditioning coach, until, you know, you were in it and like, again, saw your presentation and to say like, you know, I know like I'm probably using like communication techniques without realizing it, like subconsciously, the way I talk to people, the visual cues I give them to increase their understanding during a session of how to position their body, whether it's a S&C session or working with an older person as a personal trainer. But then again, seeing your presentation, and like I had taken also a course right before that on like SLPCU or whatever it was. And it was like concussion in athletes and the SLP's role. And it was a very brief overview, but that was like, wow, this is cool. Right. Admittedly was like probably half listening to it because I was doing something else while trying to get all my CEUs in. Right.
Multitasking.
I have this pamphlet come in the mail, which is completely random. And I see your course being offered or your presentation being offered as an opportunity for CEUs. And I read it and I'm like, a whole day of talking about this, like, that's amazing. Right. So I go and understanding, like I knew I had worked with some TBIs like early on in my speech career, actually more so during my graduate like clinicals. And I knew like what my role could be, but I don't think I realized it from like the TBI standpoint. And then for some reason had never connected it to like return to play after concussion with athletes. So I haven't quite had the opportunity to do that. But now that I have this understanding and this more developing understanding and seeing ways that I can integrate this into what I do on a daily basis and to offer that as a service, right? To be like, hey, you know, you want to work a little bit on this, like to think that there's potential that I could work both of those things into working with an athlete and make a difference for them, not only from the SLP standpoint, which is my first passion, but like the second developed passion of like being a personal trainer or a strength and conditioning coach. Like, how amazing is that? And it was like, to me, it was like, I always have to keep these two things separate. Just understanding the potential of where this could go in the future. I'm still like so scatterbrained about it all. I don't even know where to pay attention. And that's probably where these conversations will come into, will be very helpful in the future, maybe with you. But I mean, it's overwhelming. Like we probably can sense the feeling of me being overwhelmed, like in the way I'm talking. Cause it's just like, what do I talk on and where do I talk about it type thing.
There's so much to talk about, which is why I'm so passionate about this topic. Because so many, I always say everyone needs to hear this information. And for you to be a speech therapist and a sports and fitness strength trainer and former athlete, there are just so many skill sets that we have as speech therapists that we can pull on and draw from that can continue to support and serve those who are in need. So I think that, like you said, it was fate for you to come.
Yeah.
And I think it's great that you also had another course that kind of piqued your interest enough for you to make that drive to JFK. So thank you so much for even attending. It means so much. And when people like you come up during presentations, after presentations, and speak to how it has affected or impacted you in such a positive way, really helps to motivate me, because I'm sure, as you know, from not knowing where to go in so many different places, that we have a long way to go. And there are a lot of additional conversations that need to be had. But I would like to know, from your perspective, what advice would you give young women who want to compete at a high level, but also want to protect long-term brain health? Because now there are, rules and legislation that are trying to be put into place to where they're stopping heading of the ball until, I believe, the age of around 14. And I know you said that travel ball and club league and things like that, they're starting transitioning around the age of 8. That's a long time not to be heading the ball. So for women who are interested in pursuing sports, what would your advice be if they're also wanting to protect their brain?
Yeah, I think that informed decisions are important. And if you have the information in front of you, reflect on it and don't just think about yourself in the moment and even just the maybe year or two surrounding that time. But understanding that in the future, like you've mentioned, and there's a book, The Body Keeps Score, right? That there's potential, right? There's potential consequences to these actions that we take that we think are just second nature in sport. That our body keeps score, our brain will remember. Maybe it doesn't impact you in the moment. So, I think I was a case that was like an extreme case of heading the ball. Like I said, it was just like all the time. Like I was seeking to do that. Like that was my X factor. I don't think that most players are like that. I think generally, the incidence of heading the ball for an average soccer player is probably much less, but we also know that it just takes one time, like one or two bad times, right? So it's just like also understanding to take care of your body. I didn't really learn that. I still care of my body from an athletic standpoint, like being active, but in the space that I'm in now with sports and fitness and well-being and health, right? Like I've learned a lot about how to fuel my body, what to eat, what to avoid, how your body does keep score of what you feed it, right? And you are what you eat. And there's things that contribute to inflammation, and inflammation can contribute to exacerbation of symptoms of things like ADHD and, OCD, and even just mood disorders, depression disorder, mental health disorders, which what are all of those things symptoms wise have similar with, right? Brain injury. So it's just understanding that, like, if you're making that decision to continue to head the ball or potentially, put yourself in those situations, that there can be consequence. But I think there's also so many things you can do is to help yourself as you age, right? To keep your body happy and to feed it and nurture it and treat it as a temple. And just understand that, like, human potential is pretty magnificent. So if we treat our bodies right, like, they usually reward us. So I think my biggest piece of advice is to just, educate yourself. I tell people all the time, like, I have the same access to information as doctors and whatever else. Like, I can read a book, I can look information up. Technology is, detrimental as it could be at times. The enhancements of it have contributed to us being able to access information. And if you're curious and something doesn't sit well with you, you're experiencing symptoms, or you have fear associated with something, an action you're taking in sport, like, look into it. Like, you can read about it, you can find about it. There's someone you can speak to, right? There's someone right in front of, like, two people here, or especially one, that you can reach out to. Yeah, that you can inquire with and just talk to people about it. I think that would be my biggest piece of advice. Yeah.
I love that. And it is appropriate for both genders. So thank you very much.
Yes.
All inclusive here on Candid Conversations. So I want to get to the Candid questionnaire, but there's one question that I really want to ask. And this is actually stemming back from my time at ESPN. So listeners who are not familiar, I did have an internship at ESPN. I was a journalism mass communication major when I started my collegiate career. And when I was at ESPN, it was, I think it was the FIFA Cup that was being played. Either way, it was, all hands on deck, like all these TVs that are around, if you can imagine, in Bristol, Connecticut. So everybody is watching what's happening with soccer. And I saw some of the most intense and devastating injuries that I had ever seen on a field. And that included people getting, I don't remember the actual term, but when cleats, get an opponent or a teammate, and, the skin or muscle, it's just shredded. It looks so horrible. The way that there can be collisions, you all don't have pads aside from your shins, not like, in football or lacrosse or something. And so I made a bold statement, and I said that soccer was more like ferocious and intense than football. American football, for those who are, who know that soccer is also called football. But I was like, the males that were around me, these red-blooded Americans who are like, how dare you say that? But I'm like, football players have pads. Like, these soccer players are running at each other full speed, clipping each other, like their skin is being shredded in some instances. And I'm like, I think that's pretty freaking ferocious. But I would like to know your opinion on a statement as bold as that.
I don't disagree with you, but I understand the audience that you had when you said that. It'd probably be the same audience that, like, called soccer like foot fairies. I've heard that.
I've never heard that.
Yeah, that was definitely a bigger one. Like, I haven't heard it as of late. Yeah. Right.
How dare they?
Right.
To all of you who could say that, how dare you? Look at what these athletes do.
No, but I think that where soccer lacks some of the physicality, right? Like, we can't get away with the contact that they get away with in football, but we get away with quite a bit of contact. Like, we lack that physicality as far as, like, how much football's getting, but we don't have the pads on.
So some of it's done on purpose?
What I'm saying,
possibly.
Are you talking about the injury?
Yeah, like somebody could, like, is it called cleating someone, or what is it when you?
I mean, anybody that's doing that on purpose, that is just not appropriate. But it happens, right? But, like, slide tackling, yeah, like, you catch a cleat to the head. You have shoulder to shoulder opportunity, as long as you're not, like, they let you go. Like, if you're at shoulder to shoulder and you're colliding, like, they'll let you go. And it depends on the ref and everything. But I think that we reach forces, and there's just so much potential for, like, collision, not just with players. Like, there's goalposts, right? Like, in a corner kick, you're heading the ball, you hit a goalpost, a goalkeeper trying to keep the ball out of the net hits a goalpost. Even, like, the fouls that aren't seen or aren't called, right? Like, I was an aggressive player. I'm not going to lie about that, right? And there's things that I could maybe get away with because of how our bodies were positioned, that if someone saw that, it would most certainly be a yellow or a red card, right? Because that's how you get penalized in soccer. But yeah, I think that it is a sport that I think sometimes, like, people don't view it as a physical sport, but really it's the only one besides rugby, obviously, like, that they don't play with any pads, right? And they tackle like football players, American football players, but there's really no sport that compares to it. like when you don't have any pads on, besides rugby, like I'm saying. But you know, like even basketball, like you don't have the space to gain speed as much, right? Like it's just different. And then females we're ferocious. Like if you watch female, like a female professional league game versus a male professional league game, like the male gets clipped and he's going to put on, the other guy's going to put on a show to try to get the foul, right? To get the call. And they run it back, and you know, it's like the theatrics. They could have won an Oscar, right? But the females, they're going to go until actually somebody hits the ground, right? So the contact was pretty intense at times. Yeah, 100%. So I don't think your statement was unwarranted whatsoever. I think that people that reacted strongly to it were probably just the ones that have never played it, or, you know, maybe wearing the pads on the football field. We also run for 90 minutes straight with no, like we're having levels of fatigue that, like, you know, we're running the whole game. A midfielder that plays on the pitch for the whole game is like, you know, at a higher level is reaching like 7-8 miles in a game, like covered.
That is some serious endurance.
You know, like versus like offensive, defensive, and football, like every play there's a break, right? Every play is a break. So
right.
I'm not trying to
you're saying it in all the right ways.
But...
Yes. We are not bashing football.
No, I love football. Go
yes,
Eagles.
We love football. We love football players. I just watching that so intently, you know, with, you know, TV studios, there are so many televisions, and to be able to zoom in and see the footage, it is really intense. So thank you for vindicating my thought from all those years ago. But
and I have to add one thing to that, if you don't mind. If you've never seen it, one of the most badass, if you will, excuse my French, I'm so sorry, but
go ahead,
plays that I ever did see was Abby Wambach. I don't know if you know who that is. She was okay, so you look her up. She was, I mean, one of the greatest of all times as far as U.S. women's soccer goes. She's retired now. I don't know what World Cup or game or Olympics it was, but she got her head split open in the game, came off. There's videos of it. You can look it up on this after this.
I'm going to.
Got her head stapled shut and went back on the field.
Now, like a woman.
Right? Now, could you imagine? Have you ever seen an American football player do that? They got helmets on, but you know what I'm saying? It's just, it's gnarly. It's a gnarly sport. It really is.
Wow.
And yeah.
When you said one of the best U.S. soccer players, I immediately pictured Mia Hamm and her pulling the jersey off during that win.
Yeah. So I have, if anyone that's a soccer fan listens to this and I didn't correct that, that was Brandy Chastain.
Brandy Chastain.
Same team,
same game.
For knowing that. Yes, exactly. But yes, Abby Wambach is up there with those ladies. She's one of the top like goal scorers of all time for the U.S. women's. I'm not sure if she's at the top anymore, but she was at one time for a very long time. And
in our hearts, she will be.
But amazing, and she was deadly with her head. So you definitely should look up that video.
I absolutely will. Thank you, and thank you for that correction.
Yeah, no, you're good. No disrespect, but I had to. I was
like, you know,
Candid
Conversations.
Yeah,
we can't all be perfect. We can't know all the names, but I welcome any kind of correction. I don't want to be inaccurate, so I thank you. I'm not embarrassed or anything. You know, we're imperfect.
Yes, we are.
People teach me to be candid and imperfect, so I appreciate that. I'm not embarrassed or anything. I welcome it.
Hey, listeners. I'm inviting you to connect with me and be part of the Brain Talk movement. It's super simple. Just visit braintalkfoundation.org and subscribe to our newsletter to become one of my brain buddies. You'll get updates on upcoming Brain Talk days, find out when I'll be speaking in a city near you, and get insights on what's happening in the world of brain health and concussion awareness. Join our community of change makers because together we can make a difference. Visit braintalkfoundation.org and become a brain buddy today.
Okay, so let's get to the Candid questionnaire.
Mm-hmm.
First question. What's one word your friends would use to describe you?
Kind.
Kind.
They'd probably say nice, but kind sounds better.
I like that. I sign my emails kindly.
Yeah.
Yes, I think that is accurate. You present very kind, you look very kind and
Thank you.
nice. You're welcome. Okay, question number 2. If you could instantly master any sport or physical skill, what would it be and why?
Oh, I'd have to say playing some type of instrument. I guess that would be a physical skill, correct?
Yeah,
Yeah, I would
absolutely.
say playing some type of instrument. I've always been kind of interested by the idea. I've always made like kind of uh small attempts at doing these things. Tried a piano once when I was a kid, bought a ukulele a couple years ago and tried even that. But yeah, never follow through. So if I could instantly master that and skip the learning part, that would be pretty cool. So probably like
Yeah.
some type of string instrument or a piano would be
Okay,
awesome.
I like
Yeah.
it. I like it. I play the
Also,
flute.
yeah, go ahead. I'm sorry.
It's okay. I play the flute probably from like 4th grade to right up until high school. And definitely played piano, but I couldn't play for long because my nails grow really long and they kept trying to get me to cut them down. When I was young, people thought my nails were fake, but like, no, they just grow this long. But I didn't want to keep cutting them to play. And, the clicking on the keys wasn't great. And then with the guitar, I wanted to play that, but you have to develop calluses on your fingers. And I
Yeah.
didn't want to do that. But what were you saying?
No, I just feel like that's one thing too. Like, the sports thing, I feel like I had that. I feel like the artistry of music is just a different part of the brain, right? I've always been intrigued with, and you probably are familiar with this, but people like, there was Tony Bennett was an example, a real-time example, and Glenn Campbell, who, despite a neurodegenerative disease of dementia, they got on stage and heard the first tune of a song, they could sing the whole thing. So there's
Absolutely.
something to say about that. So just enhancing a different part of my brain would be pretty cool.
Yes, or anything artistic if you think about it. I
Yeah.
saw, I just posted this video of a woman with dementia. She may have been in her 80s, but she was a former ballerina, and they put, I think it was Swan Lake. They played that for her, which was a performance that she did.
Right.
And even through, the way that her body was conditioned at the time in the wheelchair, she was doing the motions with her arms. She had her hands fluttering. She knew when to put her head down and bow. And then they put the clips of her performing
Oh, that's
between her
amazing.
actually doing it. It gave me goosebumps. I've got
I have
goosebumps
it
now
right
just
now. Me too.
describing it. I'll have to send it to you, but it
Yeah,
was
please
so
do.
beautiful. And I love seeing that with the geriatric population, because you see older people out in public and they may have a rollator or they may be shuffling along, and society can approach that with impatience or like, I wish they'd hurry up. But on my end, I'm thinking like, I love that they're out and about and able to ambulate and they're safe and they're not bedbound, because being in a SNF,
Yeah.
skilled nursing facility, for listeners who don't know, being in a SNF, you see patients who can't walk anymore or need a bedpan to go to the bathroom. So walking slowly, walking with a rollator, but if they're out going to TJ Maxx or the
Yeah.
grocery store or something, that just warms my heart. So I loved that video of her dancing in her wheelchair. So I'll send that to you.
Yeah. That's amazing.
Yeah. Okay, moving on to number 3. What's one activity or hobby you find most relaxing or beneficial for your brain?
Ooh. I don't like to label exercising as a hobby. Some people
Oh,
do that just because I know it's beneficial for my brain.
one
But
interest?
yeah. So I'll say this. I I drop off with it sometimes, but one of the most, I think, profound things that you don't need anything, just some practice and time and patience at it, is just breath work. Uh, just like breath work meditation. So being able to sit in a quiet room, close your eyes, and focus on your inhales and exhales, and not get frustrated by thoughts that consume you, but just like them, let them come and let them go, let them come and go. And then before you know it, with practice, you can almost get into this. It's deep meditation, where it's almost out of body. So I would say breath work, and I tend to do that before I go to sleep when I lay down. So
Or a podcast?
yes, yes, right before a podcast. But yeah, there's I mean, just the afterwards, after doing it, it's almost like you can take the deepest breath that you haven't been able to take. And there is this euphoric, it's practice. I'm not going to just say it's, you can just do it, right? It does take practice and discipline, but there's just a cleanse, a very euphoric thing that happens after you just, even for a couple minutes, just focus on your breath. It's just so calming. And if your brain's really noisy and you can't quiet it down, that's something you could do anywhere without anything at any time, right? So breath work and meditation,
I love that.
I'd say. Yeah.
And it is a practice.
It is a practice.
It can be a challenge because I think about my attempts, I'll say attempts, at breath work and meditation. And when I can get it, I can actually zone in and silence my mind, it is beautiful. And I love that you spoke to the euphoric experience of it, because it can be absolutely that. But it is practice, because in times where, the to-do list is rampant and there are a lot of things that are going on, it can be hard to be still and be silent, because you're thinking, okay, I have a moment, but I also have to do this and I need to go this and I need to make sure I get there. So listeners, it's an exercise. It is, you actually have to put in effort for it, but I love that.
Yeah.
Go ahead.
I'm sorry. It started in yoga. My wife does yoga. She's a certified yoga instructor. And I remember when I first started going yoga with her, it was more so my back pain before I figured it all out. And there's shavasana at the end of yoga. If you ever gone to yoga, it's the brief few minutes that they ask you to just lay on your back. And they put sometimes music, sometimes none, but you're just directed to sit there and to just kind of reflect. And it's an opportunity for meditation and quiet and stillness. And I just always remember leaving, and, my wife would say oh, I got myself on the beach in Maui, and I was sitting, I'm like, what? How? I'm sitting there fidgeting, frustrated with myself because I just can't turn my brain off. And that's where I think people, it's misunderstood. It's not that you need to turn your brain off. It's that you need to be able to be still with your thoughts and just let them come and go, essentially. So took discipline, it took practice, and even times now I'll fall off of it, and it's hard to kind of get back into that deep kind of meditative state with it. And maybe you won't get there, but just breath work in and of itself, box breathing, simple box breathing. Again, it just it garners you an opportunity to just connect with your breath when it's such an involuntary thing that we do. We never connect with it. And I think people will be surprised if they listen to this podcast and try it, that if you do it, you probably will maybe breathe deeper than you did in a long time. Let's just say that.
Well, you're motivating me to make another attempt, because I'm definitely in this state that you were in, or I'm why can't I thank you for the piece on not shutting your brain off, but just being present with it and allowing it to come and go. That's very helpful. We're in the week, listeners, you'll hear this later, but this is the week that Brain Talk Day is taking place for 2025. And I'm excited because we have someone who is a yogi who's going to be there teaching about breath work and mindfulness. So I'm really looking forward to that. And this yogi just so happens to be a former professional football player. So
very cool.
He really got into yoga and the stillness, and he is a yogi. He's an instructor as well. So I'll have to reach out to him and make sure that I'm doing it correctly. But now I also have the reference to you and your wife. So thank you for that.
Absolutely.
All right. Number 4. What's the weirdest or most unexpected item in your bag or car right now?
I don't carry a purse. I carry a backpack, which it goes everywhere with me. Weirdest thing. In the car or in the that's a tough one. So much trash in my car. I live in my car. I really do. I never was that person, but I drive so much for work that it's just there's just so much stuff in it.
But you're in Jersey, which means that they put gas in your car for you.
They do.
That excites me so much. And it kills me when I talk to clients who are like, oh, I hate it. I'd rather do it myself. I'm like, it's cold up there.
Yeah. If someone, I would say probably just all the it would be my speech bag. like if someone went in my car without any context and just saw this bag of like toys, they'd be like, what is this person doing? Type thing. Just like,
Okay.
there's all kinds of like puzzles, and it's my speech bag for my kids.
Okay.
Yeah. I can't
That
think of,
seems
I'd have
to
to be in the
be
car to tell you.
that seems to be popular with professionals with not, I guess you could say, run of the mill or well known professions. I
Yeah.
hear people when they talk about their professional accoutrements. So that is right on brand. Okay, last question. What's your go-to guilty pleasure TV show, movie, or song?
Okay, so I definitely don't have like a guilty pleasure like TV movie. I'm not a movie person. The TV shows are like, I don't waste time on TV shows. Like I watch them because like
Especially not today.
I'm interested in them, right? But the first thing that came to mind is Man Child by Sabrina Carpenter. I don't know if you've heard that song. If you haven't, you have to listen to it. It's
Okay,
catchy.
listeners, make sure you go listen to this song.
She's not someone, I only say that because it's no disrespect to her. I'm not a pop really person. I like pop, but like I wouldn't be like, oh, Sabrina Carpenter's album's coming out. Like I'm not that person. And it's funny because she's talking about like her history with like the men she chooses, that they're man children, whatever.
Yes.
I can't relate to that. Just obviously like reverting back, I have a wife, so it's just funny that, like I'm singing this song like, and it's catchy. It's called Man Child.
I love that.
That would probably be my current guilty pleasure song.
Okay.
I rock out for that.
Well, I'm going to give that a listen. Listeners, make sure that you give that a listen too. It sounds like a good one.
Yeah.
It sounds like it's catchy.
It's
If
catchy.
it is catching the ear of someone who's not a pop person, I'm excited to give it a listen. Leah, thank you so much. I know that your story, the gems that you dropped are going to resonate with our listeners. I appreciate you taking the time to come on and share with us. It really means a lot to me. So thank you so much.
Yeah, absolutely. I was happy to be here, and just thank you for what you're doing. I truly think that everyone has a route they can take and a passion that they can, like somewhere they're supposed to be, and everyone just has to kind of figure what that is out. You certainly have figured it out. So I know it's hard. We talked about it's hard to say no to opportunity and to not grasp all the opportunity and the things on your plate to contribute to this space and this passion that you're in. But just remember too, you have to take care of yourself. That's what the thought I'm going to leave you with, just because I'm taking my own advice, because I've had to take that advice. I still take it every day, that if we don't have our health, we don't have ourselves, then we can't put and pour into the things that we're doing. So
I receive that. If we don't have our health, we don't have ourselves. I love that. And I do need to do much better with that, which I am planning to. But now you can keep me on my toes and checks and balances and all the things. Check in with me and ask. I'm giving you permission.
Yeah.
But thank you so much. I truly appreciate it. And we will talk soon.
Absolutely. Thank you, Dr. Kelly. Appreciate it.
Thank you for tuning in to Candid Conversations with Dr. Kelly. I hope today's discussion left you inspired, informed, and ready to take on your next challenge with a clearer mind. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who needs to hear it. Until next time, keep striving for a healthier mind and a happier life. I'm Dr. Kelly, and this has been another Candid Conversation.